Good morning, everyone. Welcome to today's live update. Our first update of the spring semester. Just as we did in the fall, we will gather here every Friday to provide the latest news and information on our COVID-19 response. And we will provide updates on how we are supporting our students and our employees. We have seen high case counts in the country and in our community, and we are taking significant precautions going into this spring semester. And we're going to talk about those today. We're excited to see our students and faculty again when classes begin on Wednesday. To prepare for this, we have a lot of information to go over today. And I have with me Dr. Spencer Gregg, Director of the Student Health Center, and our incident commander since the pandemic began. I also have Provost John Somchik, who you're familiar with also. Today, we're welcoming a new face, Dr. Owen Driscoll from our news and information team, who has been working on a number of tools to support our community, including how we present our data and get information to students who are in isolation and quarantine. We are continuing to update our COVID case count and other data every day on our coronavirus page. But right now, we want to spend some time talking about the things you need to know about the start of the semester. So given the high case counts around the country, the state, and in our local community, we will begin the semester with caution and with some temporary restrictions in place. The restrictions are meant to keep everyone healthy and to remind us to be vigilant in our efforts to stop the spread of the virus. So the restrictions are familiar. They include there will no visitation allowed in the residence halls or Greek housing, so residents only in those buildings. Campus dining will be carry-out only to start the semester. There will be limited access to recreation and common spaces, and there will be limited in-person events. Lifting these restrictions will depend on several factors, including participation in community testing. We are also watching other factors and have worked to put additional information on our website that's important information to keep considering. So first, I want to turn to Dr. Driscoll. Can you walk us through the additional metrics that we now have put on the website?
Be glad to, and good to be here. So what we've added to the website is a metric summary that expresses where we are each week. And it covers three categories: our community through measures such as cases per 100,000 and hospital capacity, and then our campus health, our active cases, new cases, self-isolations, pooled saliva positivity rate, and our student health center positivity rate. And then finally, our capacity to serve students with the percent of quarantine beds in use or isolation beds in use, and our contact tracing response time and our student health center turnaround time. And we hope adding these will give just a weekly picture of where we stand.
Okay, so let's talk a little bit, Dr. Gregg, about what will you be looking for when you review these metrics? So going into this semester, metrics that Dr. Driscoll just described, what are you going to look for?
Good morning, Chancellor. It's good to be back with you again.
Good.
There's really no one metric with all the answers. We really look at the totality of the information, take trends into consideration. Are the numbers going up? Are they going down? Ultimately, we want to make sure we can continue to provide support and services for students in a way that's responsible and safe for our students and our employees.
Okay, thank you. The decision now about easing or tightening restrictions may vary from residence hall to residence hall, depending on trends in the testing. With that said, let's talk a little bit about our testing program for the spring semester. We learned so much this fall about how we can work together to keep our campus safe, and I'm proud of the job we did in the fall. Among the greatest successes was our community testing program. And because it proved to be so valuable in reducing the spread of COVID-19 on campus, we're going to be expanding it this spring. So Dr. Greg, can you tell us about these expanded testing plans?
Certainly, our residence halls and Greek housing will now have weekly community saliva tests. If you live on campus, your residence hall will have a designated day each week to submit samples. There will also be incentives for those who participate on a regular basis. If you live off campus, both undergraduate and graduate students will also now have the opportunity to join in the community testing. We're strongly encouraging participation amongst our commuter students this semester. Individual testing and patient care for symptomatic students will of course continue at the Student Health Center, and students, faculty, and staff who don't have symptoms but are nonetheless concerned that they may have been exposed can pick up an Everlywell COVID-19 at-home collection kit from the Student Health Center at no charge for convenient at-home testing.
Great. I just want to comment on one of your statements. We are going to have incentives for people who participate regularly, but it is required of students living in university housing to participate in the community testing program. So in addition to expanded testing, that's a big difference, good improvement. We have also worked to make support more easily accessible for students who may need to isolate or quarantine. So Dr. Driscoll, you've been very involved in this. Can you tell us about covidsupport.utk.edu? And I'm going to say that one more time, lowercase covidsupport.utk.edu. Dr. Driscoll?
I'd be glad to. So one idea that emerged from the fall was to better help students and employees have access to the specialized information they need when they are in isolation or quarantine. So working with the Office of Information Technology, we created covidsupport.utk.edu. Now there's some general information on there, but if you're in isolation or quarantine, when you go there, you can log in, you can see your status, you can see the communications you've received from contact tracing or isolation and quarantine support. You can update your status, you can see specialized information about housing in different locations, how to request dining, how to request transportation. We wanted to create a way to make it as easy as possible for students who are in a stressful situation and for employees too, to be able to log in, see the information that matters to them, and stay informed about their isolation quarantine status and the specialized information that they need.
That's great. I looked at that website earlier this week, and it's really a really tremendous addition to the services. Dr. Greg, as students are preparing to return to campus, what should they be doing to ensure should they get tested, for example?
Yes, as students return to campus, it's important for them to know what their current COVID status is. So just as in the fall, we really encourage students to get tested before returning to campus and not to return to campus until they've confirmed they're negative, or if they're positive, until they've been released from isolation. If they've tested positive, they should fill out our online self-isolation form. That's how we know to reach out to them and are able to assist them in getting the support they might need. I think it's important for students to also understand that case counts within the Knoxville community are higher than when they left at the end of the fall, and community spread is greater. So it's important for them to arrive prepared for that. They need to be mindful of social distancing recommendations. They need to remember to always wear a mask around others outside of their household, and to follow the other health and safety guidance that they were following at the end of last semester, especially the need to avoid group gatherings where social distancing and continuous mask wearing is not occurring. When students have arrived on campus, our community testing will start immediately, which means we'll have tested our entire residential community within the first week of classes. Students can find links to more information about COVID and our campus response, as well as details on how to access testing at our COVID website, utk.edu/coronavirus.
Thank you so much. By working together, we can stop the spread of this virus and keep ourselves, our fellow volunteers, and our broader community healthy. So now let's switch gears and talk about academics, what we're all about here. And they told that one of the most challenging parts of learning in this environment has been the inability to have spontaneous interactions and organic conversations about their studies, their interests, their lives Making these connections is one of the most rewarding and impactful parts of the college experience. We all remember that. So we've been working with our faculty on how we can facilitate this. So Dr. Zomchik, can you talk to us a little bit about what faculty are doing to engage students this semester?
Yes, thank you, Chancellor. I'm glad to. So we're using what we learned during fall semester to better engage our students, whether they're sitting in one of our distance classrooms or in their residence and attending remotely. For example, on teaching.utk.edu, we've posted just-in-time teaching tips, which are short pointers on how to engage students in these pandemic conditions. There are video and audio materials there for our faculty to consult, as well as links to materials from external experts on everything from stacking assignments to creating discussion groups in Zoom to starting the Zoom meetings early before the actual class starts and leaving the Zoom meeting running after the class finishes in order to allow students to talk to one another, to make those connections that they tell us that is a bit challenging in this pandemic. We're also continuing to offer course managers to our faculty. Those course managers help our faculty manage the technical aspects of the class so that the faculty themselves can devote more time to interaction with the students. And we will again have faculty fellows who will consult with faculty about any particular challenges that they've encountered or are encountering in their instructional practices. And finally, starting next week and throughout the semester, we're going to have in-person events for faculty to come together to share their successes in the classroom, what works in terms of engagement, and to discuss challenges that may be creeping up over the course of the weeks of instruction.
Hey, great. So one more question, Provost Zomchik. So what are we doing? That was about in the classroom. What are we doing to engage students outside the classroom?
All right, I'm glad you asked that. We've got big plans, especially for our first year students. Tomorrow, as the students begin coming back to campus, we're kicking off what we're calling Big Orange Welcome, which will be for all of our first year students especially, not just the new students who are joining us this semester. And it's not just 1 week of welcome, but true to its big name, it's 6 big weeks of activities. We'll have over 300 programs offered by over 30 offices, both academic and social in nature. All these events are meant to help our students make it through the first weeks, while some of the restrictions that you mentioned at the beginning of the update are in place. I'm really excited about all these activities. And I also want to point out that we'll be doubling down on our academic support services to provide extra help, whether it be tutoring, supplemental instruction led by peers, or study pointers and tips so students show up and show out to all of their classes. And if I can have one more moment of time, I want to talk about something that we've been hearing. We've been hearing that some instructors who are teaching face-to-face classes are being asked by students to offer the class in a fully online modality. Students, if you've registered for a face-to-face class, you'll be expected to show up and show out in the classroom. Now, if you want to switch from a face-to-face to a fully online class, there's still time to do that, but consult with your advisor and drop the face-to-face class and register for a fully online one. But before you do that, remember, we've worked really hard to make our classrooms safe for all volunteers, and we continue to believe that they're among the safest places anywhere. So that's all, and I really look forward to the students' return, faculty return next week.
I'm glad you added information for the 2 different courses is different, and the technology needed for two different types of courses is different. So I'm glad you added that. Talk to your advisors is what I heard you say.
Yes.
Okay. Well, I want to thank all of our guests this morning, Dr. Zomchik, Dr. Gregg, and Dr. Driscoll. And thank you to everyone, all of you who joined us this morning. We will be doing these again on Fridays at 11:30 throughout the semester. We're excited for classes to begin next week. We want to see everyone again, whether it's on campus or on Zoom. This extended break has given everyone a much needed breather, but it's also made me miss you all even more and can't wait to get past the pandemic. Over the break, we saw the distribution of COVID-19 vaccine begin. Some on our campus, for example, staff at the Student Health Center, our UTPD, have already gotten their first doses. I'm filled with optimism that the turning point in this pandemic is nearly here. But while we wait for the vaccine distribution to reach more and more people, we have to continue to take precautions and adhere to all the health and safety guidelines. So fill out your daily your screener, wear your mask, keep your distance, and participate in our community testing program. We are relying on you and all of our fellow Vols to do their part. Thank you, and we will see you next week. Go Vols.